Welcome back to the Medical Board Exam Experience with Dr. Kwafo. Today we are continuing our series of how Dr. Sebastian failed USMLE step exams but successfully marched into the NYU Langone Hospital Internal Medicine Residency program. Today we are going to focus on how he built his CV, obtained US clinical experience and research opportunities. Let us join Dr. Sebastian in our discussion room. Thank you. Viewers, on this channel, I interview doctors who have successfully passed or failed any medical board exams to share their exams preparation experience with us and with all those preparing to write theirs. If you are watching me and you have experience in any medical board exams and would like to share with us, kindly contact me on my Facebook page, Instagram, or leave a comment at the comment section of this video and I'll keep in touch. Please do not forget to subscribe to this channel and recommend this channel to any medical student or medical doctor who is preparing to write the board exams of any country. Thank you.
Those 4 letters.
Okay, so now let's come to the research. It's usually difficult to get this opportunity in US. So how did you obtain the research experience you had?
It's really hard because, as mentioned before, people don't know you, and it's hard to find an opportunity. I didn't know anybody here before to give me a hand or recommend me, so I had to do everything on my own. So the idea that I got was, first, every conference, symposium, talk, anything that I could attend, I was going and trying to talk to people, trying to express my interest, the things that I was looking for, and that helped. That helped a little bit, but I think the most important thing was sending email. I went through the website of academic institutions, and you have to be really good looking things online, because sometimes to find emails from faculty members or principal investigators, they're not easy to find. You have to go around and click here, click that, and then you're gonna find emails, you're gonna find information. You can also have your LinkedIn account. That was very helpful for me. I opened my LinkedIn account, and sometimes I couldn't find email, so I look for the person in LinkedIn, and I found some people and made some connections using that resource. And after sending hundreds of emails, I was sending, while I was preparing for the CK, I was sending emails every day. I was sending 20, 30 emails. And for a long time, almost for 2 months, I didn't get any replies. And I was kind of sad, because, you want something. You want at least a little bit of hope about these positions. So I keep insisting. I keep sending every day. It didn't matter if they weren't replying. I was just consistent, and I was believing at points I was gonna answer. And then it happened. I got one reply about a volunteer position in one of the hospitals in New York. So I used that opportunity. Of course, I wanted something paid, because my savings were down. But a volunteer position is a really good thing to start. So I got that opportunity, and I started going to the hospital 3 or 4 times a week, learning about research, getting connections. For example, that doctor that I did research with him, when I needed guidance with my personal statement, with my CV, he was one of the persons that helped a lot with that process. So you never know during your journey, if you're gonna meet people that in the future they're gonna be really helpful. So I get that volunteer position. I was there for 3 months, and then, but I didn't. When I was doing that research position, I was sending emails, sending more emails, adding that volunteer position as a as a plus, because when you're doing a volunteer position, that means that somebody believe in you and somebody give you the opportunity. And after that, I got an answer. I got a reply from one of the emails from one of the PIs from Columbia University. And I went through the interview process, and then I got another reply from the same institution, and I started the interview process for that. And I was really fortunate to, at the end, get an offer from both of the research positions, and I decided to take one of them, and that's why I got the research. I didn't know anybody. I was just like believing in myself and sending emails all day, all the time until somebody replied.
Okay, so during the interview, were they expecting you to prove some things, or how was the interview?
Uh, Really, like interviews here, they already know your background because you already send your CV or resume. So the interview is to get to know a little bit about yourself, to know how you interact with people, how you can be a leader, how you're able to manage difficult times, if you're responsible. I think the interviews are a little bit more to learn who you are, and they want to confirm that they can trust you, and that you're gonna add something else to the institution, something positive.
Okay, so the research, was it a paid research or something that you were just you volunteered?
The second experience that I got, the second position that I got at Columbia was a paid research.
Oh, okay, okay. So you, after the research, it was published and your name was put in the publication, or you didn't finish the research at all?
So this is gonna be funny, because in the place where I did the volunteer position, I was there for 3 months, and after I left, they I found out that they added me in 3 publications.
Oh,
So
okay.
that was really good, and I really appreciate that from them. And it's funny because I spent 2 years at Columbia University. Position. I was there for 3 months, and something that it was gonna take a long time to have a publications, and being one of them. So probably I'm gonna be in one of them, but not in the near future. Probably in 1 or 2 years, or 1 year. But when I was there, I wasn't I wasn't in any publication, but um, I got a really good experience there, and also adding that I was in an important academic institution in the city was something that opened me doors to other places during the application process.
Oh, okay. So for someone who is also looking for research, now that you've had the experience, what's what is the best way for the person to go through?
I will say two things. First, email people, write a good email, not super long, two, like probably two small paragraphs, talking a little bit about who you are, why do you want the research position for your life, and also express that you're committed. Like, there is no just saying I want to apply for residency, and I need this research experience in order to get a residency position. I don't think that's the way to address a research option. I will that you want to get experience career, and you want to explore research, because you probably research is one of the things that you want to do for the long term. And that's true. When you're doing research, sometimes you really like it and you don't want to apply for residency and you want to keep doing research. That's a good thing. But have that opportunity or express that you want to do research, not just because you want to add that to your experience for the residency application, but added that as your own experience with research, because that's going to help you no matter what, if you do or if you have resident. So,
Okay.
emails, don't give up if they don't reply. Keep sending. If you have to send them twice, if you really like a resident, if you really are interested in that topic with that doctor, with that principal investigator, they're super busy. And sometimes it's not that they don't want to reply, it's sometimes it's that they don't have time to check the email every day. So try to use sending emails, send. I'm sure your 500 ever is gonna be open. So don't give up. Keep sending. Focus on one specific area that you wanna do research. And if you're interested in chronic conditions or whatever you want to do, focus on that and look for somebody that can help you. Also, if you can look for somebody that have a similar background as the background that you have, probably those people are gonna understand you a little bit better and are gonna open an opportunity for you.
Okay. So now let's come to your residency application. How many programs did you apply to?
65.
65. And how many interviews did you get?
5.
5. Okay. So after those 5 interviews, did you expect to be called or to match?
Of course.
No, depend on how the interview went, the question they asked, how you responded. Did you feel you did well in
Yeah.
all the 5 interviews?
I felt really good with the interview process. I mean, basically, I that was uh, at the beginning. Like my first interview was really stressful because I didn't know what to expect from them. But after that, I realized that this is an opportunity for them to get to know you better. Um, Nobody, like, to be honest, nobody asked me questions about medicine or questions about weird things that I didn't know. No, everything was related with my life. Like,
Oh, okay.
what do you want to add to this program? Um, what the special things you have to keep this program getting better?
Okay.
Yeah, basically that's what I was, just sharing my thoughts, sharing my experience, and also had an opportunity to get to know them better, to ask them questions about their life. You don't have to go to a deeper personal level, but you can get to know them better. And there is one of the interviews that I had that we didn't talk at all about medicine. We just talk about our hobbies, about what the things that we like to do during our free time, show. It's not because they're looking for somebody that have the ability to be engaged in a community and
Mhm.
add positive things to that community too.
Okay. So did any of the interview ask you to explain why you failed a step, the step 1?
Yes, but not all of them. Probably just one of the interviews asked me about that, and it was a really good opportunity to express that it was a difficult time, but that I did my best to overcome that situation, work harder, and pass the CK in the first attempt with a better score.
Oh, okay. So in your opinion, do you think their research played a major role in your matching?
Yeah, I will say that probably 40%.
40%. Okay.
But
Okay. So,
no,
mhm,
I mean, my research was, it has a lot of plus, a lot of good things. First of all,
okay.
I was able to have patient interaction. As I told you, I was traveling, going to participants' homes and talking to them and doing, um, asking about risk factors, family history, doing a little bit of counseling, doing physical exams. So that was something that added a lot to my research experience. But for example, if you are doing research in a lab all the time, probably it's going to be very helpful, but it's going to be a little bit less impact in your CV. Of course, the research
Okay.
always have a positive impact, but based on what type of research you're doing, it's going to be a little bit higher or not. But I
Mm,
mean, but probably around 40% of my like was because of the research experience.
okay. And do you think the research must relate to the program that you want?
If I match in the program that I want,
Yeah, for instance, if you want to match into maybe a gynecology, do you think you have to do a research related to gynae or it doesn't matter?
yeah, I think you have to be consistent with what you want. If you want the research should be related with the specialty that you want.
Oh, okay, okay. So when you finally match and you started your residency, how was your experience? The first week, how was it at the hospital as a new resident?
It was a challenging experience. I it was been a while since I was in a hospital environment, so it was challenging. It was the first 2 weeks were very hard, difficult. The schedule is you have to be in the hospital for many hours, but I mean this is what I wanted. This was my dream, so now I feel that I adapted and I'm feeling great. I'm so happy and I'm so excited that my first that was my first choice and I matched there. So it's everything I want.
Okay, okay. So you said you have to be in the hospital for many hours. Can you tell us a typical day for a resident from morning till you leave the hospital? What are the things the residents do in the hospital?
So it depends because every rotation is a different schedule, but I'm just gonna talk a little bit about wards when you're in patient floors. At least in my program, you have to start. You have to be there at six between 6 and 6:30 a.m. Some when during your first week, you can get a little bit earlier, like 5:45 or 6, because you need more time to read about the patients. Then from you have to do a receive the patient from the 19th floor, like the 19th. So they're gonna tell you about what happened overnight, some changes, things that you need to watch out during the day. And after that happens probably around 6:30, 6:45. Then from 6:45 to around 8:30, you have to go and check your patients, evaluate them, do a physical, talk to them, see what happened, and then after that you start writing your notes around 9:15. You have to do the rounds with the attending. It's an opportunity to do teaching. They ask you questions, you ask questions, and review the patient. What are you gonna do? What are we gonna change? Is this patient going home? Is this patient staying for more time? Then we every day we have a noon conference, so we have to go from 12 to 1 to a noon conference, something academic related. Uh, uh, we faculty member lead a talk about specific topics that they're important for the interns and for the residents. And then in the afternoon, you come back to the floor to finish your notes. And if there are admissions or new patients, you have to work on those admissions or downgrades from the ICU. And then you finish all the pending things that you have to do overnight, well, during the afternoon, if you have to take blood cultures, ABGs, send labs, review labs, talk to a consult, GI, ID, whatever consult you need to address. Twice a week in the afternoon, we have intern report. It's from 3 to 4. We'll review cases, interesting cases that we have in the floors. And then at 6:30, you're supposed to do the handoff. So with the night team intern, you have to do a handoff and let them know what you want for them to be watching overnight. And you're supposed to leave around 7, but sometimes that doesn't happen. Sometimes it's at 8 or 8:30 or 9, or that depends on how adapted you are and how fast you finish your notes and you leave without being worried that something that you're missing something. And then the next day you have to be there at 6 a.m. again.
Okay. So I understand sometimes some residents lose their slots, they kick them out from the program. Um, is there any assessment? Do they assess residents that some people feel to the extent that they have to kick them out?
Can you repeat the question?
I mean, is there any way? Do they assess residents in any way as they have their residency program? Are there times that they assess them? They assess the residents.
To see how they're feeling or like how they're doing
Are there any exams for them? Other written exams, like any exams, assessment exams for them?
Oh, okay. For the residents,
Yes.
yes. But I think it depends on every program has a different curriculum, different schedule for the assessment for the test. At least our program, um, we have every year we have a kind of like a step, like a preparation test for the boards. It's called IATE. I'm taking it this week. It's a 9-hour test. It's like kind of like the step
Oh,
one.
wow, really?
Yeah.
So we never really finished the boards.
Uh, so we'll see how this is not supposed to be a pass fail test. It's just to check the things that you need to improve during in the rest of your intern year, and then during your second year, you're gonna take it again and see if you improve, or it's just to see what things you need to work harder or study or do better. And every 6 months, we have a evaluation with the faculty members and the program directors. They're evaluating you every 6 months to see
Ah,
how it's
mhm.
performing.
So is there a point that a resident will be sacked from the program for not performing in either the evaluation or the test?
I mean, when you sign the contract and you're accepting that you're gonna follow the rules and you're gonna be responsible. I mean, I think you do a really bad job or be really irresponsible to like be um, like out of a program. But I mean, if you do what you need to do, I need to do. Um,
Oh, okay. So Now that you have really experienced the US system, is it up to expectation or it's over exaggerated?
No, it's getting it's what I was expecting. It's a really good academic, high environment, and really good pathology. I mean, in the hospital that I am, the population is very diverse, and you can see a little bit of everything. The faculty members are amazing. My co-interns, our co-residents, they're all very helpful. They're always willing to help, willing to answer questions, willing to be with you if you need them. So my expectations are I the program met my expectations, and I'm very happy there. I'm very happy with of course, and I think just there's no perfect system, healthcare system. There are a few things that, of course, the system needs to get better, but I mean, and overall, my experience has been amazing, and I'm so happy.
Okay, okay, all right. So are you preparing for the step 3?
Not yet. I think I'm gonna do it next year. I have to take a
Okay,
break. Just wanted to thank you for this experience. I'm so happy that you're doing this, and it's very important for all our the IMGs out there to know that it doesn't matter if you fail. Keep working hard. Stay strong. Somebody's gonna believe in your potential, and if this is really your dream, keep doing it. Keep studying, that you're gonna get your residency positions and you're gonna be happy doing what you want.
all right. Thank you very much, doctor, for your time.